Hi, and welcome to Fairview Range Focus. I'm David Hall. Today I'm joined by Paula Pennington, and we're going to talk about behavioral health services, which I know are expanding. We're going to get into that a little bit, but welcome, Paula.
Thank you, David.
So let's start. Maybe tell us a little bit. I know you're the Director of Behavioral Health Services, but tell us a little bit about that, what that entails, and it sounds like a lot of responsibility, but help us understand that.
It's a lot of responsibility, but so very exciting. My background is in nursing. I have a master's degree in nursing. I also have a health administration degree. So this job allows me to coordinate and manage our services, in our inpatient unit, our outpatient clinic, and the emergency room. We have behavioral services there as well.
Okay. Now I understand May is a special month. Tell us about that.
It is. May is National Mental Health Month.
Okay.
You want to hear more about it?
Yeah, do you have any special activities planned or anything in conjunction with that?
This year we don't have a specific May activity planned, but we do have plans for next year to engage in a walk to raise funds for NAMI,
Okay.
which is it's a National Alliance for Mental Illness. And they do a lot for our area. We have a local chapter. They provide group for families. And every Thursday, we have a representative on the floor of our inpatient unit outside the doors for families or anybody really that has questions and wants to learn more about mental illness.
Okay.
And support services.
We hear a lot about mental illness today in our society, and sounds like it affects a lot of people.
It sure does.
Do you have any idea? I mean, does it affect a lot of people here in our area or in Minnesota, or?
Well, let's start here.
Okay.
Every 3 years, our hospital does a community needs assessment. And for the last 2, mental health, in particular depression and substance abuse, our community members have put it at the top of the list. Needing more access, wanting more availability of care and education. So we know that our local community sees it as very important, as does our surrounding area. In the state of Minnesota, even though we're cutting edge compared to many of the other areas in our nation, we still have a shortage of mental health professionals and of inpatient beds,
Okay.
Which makes it tough for people who want to get care locally.
Mm-hmm. Now, help us understand, within Fairview Range, you mentioned inpatient care.
Mm-hmm.
Can you speak to that as far as how many beds are available, what kind of care is provided there? And
Sure. Our inpatient unit is 19 beds.
okay.
We have nurses, a psychiatrist, nurse practitioners, some wonderful mental health professionals and social workers. And the inpatient unit is for people who a danger to themselves or others, where their illness has progressed to a point where they would not be safe if they couldn't come to our unit to get the help they need.
Mm-hmm.
And usually it's a very short-term stay.
Okay.
And
So a few days, maybe?
A few days.
Okay.
Typically 3 to 7 days.
Okay.
Is a length of stay, and it gives them the time to meet with us and to get the help they need with group therapy and medication,
Mm-hmm.
so that they can become more stabilized and then have follow-up care after they leave.
Okay. And is there a psychiatrist involved, or is the primary care physicians involved?
Absolutely.
Okay.
We have a medical director. His name is Dr. John Simon, and he oversees the whole program. We also have Dr. Erickson, who is an employee. He comes and does work.
Are they psychiatrists?
They're both psychiatrists.
Both, okay, excellent.
Yes, yes. We also have 6 psychiatric mental health nurse practitioners.
Oh.
So these are advanced practice nurses who actually can practice independently. They are able to do assessments, therapy, and prescribe.
Prescribe medications.
Prescribe medications.
Okay.
Mm-hmm.
Okay.
So we employ 7, and they do a great job.
So they're prescribing medications as nurse practitioners, and is that reviewed by the psychiatrist or others, or?
Yes, even though nurse practitioners are allowed to practice independently, psychiatric meds are very complex. So Dr. Simon's role is he reviews all charts and all orders.
Oh, good.
And gives suggestions. Usually there aren't many suggestions, but he's, that added resource, that expert in pharmacology.
Right,
so,
right.
And we also have really great pharmacists that come up and meet with our patients.
Okay.
They do groups, and they're always available to talk about medication.
Good. I know that the unit is often full. I know that admissions come from all over. Can you speak to that, kind of where you see admissions occurring and what kind of
Sure.
challenges you see in that regard?
Sure. There are many challenges. Our unit runs at about 96% occupancy. Last month, it's usually above 92%, which is really high. There is a lack of inpatient beds nationwide, and that means Minnesota too. So what happens is our 19 beds often will be full, and we receive patients from our own emergency department, other emergency departments, and directly from their primary providers at times in the clinic. I'll give you a scenario if that's okay.
Sure.
There are times when we have patients in our own emergency department that are assessed to need our unit, but we don't have any room. So the barrier at that time is finding them a space, a bed to go to so that they can get the help that they need. Often that is in the cities, Duluth maybe, sometimes as far away as Fargo. So, we really want to help every patient that comes to our own ED, but the need is so high that often we're too full and we have to turn people away.
And you're taking admissions sometimes from outlying areas as well, is that right?
Correct. We have taken admissions from Rochester because all the beds elsewhere in the state were full.
Now, if I'm not mistaken, is there a registry within the state? They keep track of mental health bed capacity, so anyone in the state is looking for a bed, they can see what's available? Is that?
Well, every facility, yes.
Okay.
There's a state bed board, and what each hospital that has inpatient units does is they keep it updated. That way, emergency rooms can go on the website and at least have an idea of where beds might be open.
Okay.
And then call them and do screenings to see if perhaps that unit can accept the patient.
Okay. Okay. So they do keep track of that then. Okay. You mentioned about your capacity and that it's
Yes.
really full and
Yes.
the shortage across the state. So as I understand, there's going to be an expansion. Maybe you could tell us about that.
That is a very exciting thing that we're doing. In November, we will be opening another 15 beds. It'll be a unit on the same floor, and it will raise our ability to be able to take up to 34 patients for inpatient care. We believe this will help us to serve more local people. It's really hard to see people that need our care in our own area EDs and have to turn them away. So we really believe that this will be helpful in keeping people local, because then their families don't have to travel to visit them and so forth. So the remodeling is underway already. There's lots of pounding and flooring and painting. So we are looking at probably November 15th or later to be able to accept the additional patients.
Okay. And it's going to be a unit exactly like the current unit, or is it different?
It's exactly the same.
Okay.
It's classified as an acute adult psychiatric unit. It's just, well, it's additional beds. It's additional beds.
Good. Okay.
The really fun thing that's going on right now, in our poor economy especially, is we are ramping up our HR process. We are hiring up.
Okay.
And we're hiring quite a few new employees over 25. Not over 25 years old, but over 25 of them.
And that's 25 new staff.
New staff.
Okay.
And it'll probably be closer to 40 jobs that we've created when we're done, most of them at the professional level, such as registered nurse, LPN, social worker, and unit assistants.
Okay. Oh, that's
So
excellent.
it's a fun part of the job to be able to provide jobs for people in our area.
Okay. If someone found themselves in a crisis, or be it a loved one or themselves, can you help us understand exactly? I mean, what should you do? I mean, do you need a referral for care, or what happens?
Well, if we're talking a crisis such as suicidal, the first thing to remember is if you're with the person, don't leave them alone.
Okay.
Okay. If you're not with the person, you're going to want to call 911 to have a well check, to have the person get the help that they need. What happens at that point is a patient will arrive in our emergency room, and every patient, this is really exciting too, because not every emergency room has this, but at Fairview Range, every patient that comes to our emergency room that is struggling, maybe suicidal, maybe feeling aggressive, they are screened by a mental health professional to see what kind of services they may need.
Okay.
So they will have an interview. It's a telehealth interview with a licensed, either a psychologist or a social worker, to determine, do they need to be inpatient? Do they need like a partial hospitalization? Do they need outpatient? And then those recommendations go to the emergency room physician, who, by the way, we have fantastic emergency room personnel. So the mental health professional works in collaboration with our emergency room physician and nurses, and so they'll make the recommendation. And if a bed is needed, hopefully they can come upstairs to our unit. If not, they will help place and find a place for the patient to go elsewhere.
Okay.
Another beautiful thing about our services down there is if they need, say, outpatient counseling, our service will arrange that for them, and they'll call the same week and follow up to see how things are going. So they do a lot more than just find beds for us and to screen people for suicide risk. They actually help engage people in our community and get them the help that they need at the level they need.
Right. Excellent.
So.
You said telehealth. So help us understand, what exactly does that mean?
Well, telehealth is like Skype, but it's very regulated so that it's very confidential.
Okay. So there's a camera and a television screen?
It's even simpler than that. It's like a laptop. So usually the laptop's on wheels, and it's a secure connection, and most of our licensed professionals for screenings are at the university in Minneapolis. So we will connect, and the patient will be able to interact with the professional through the computer.
Okay.
And it works really well. They have an assessment that they do that is consistent. So even if a patient can't stay with us, we've gotten very good feedback from other hospitals thanking us for the in-depth psychoanalysis that comes with the patient. So we're serving our patients. They're getting great care with us, but they're also getting a head start on great care elsewhere.
Right. And so the person who's interviewing them, if that's the right term to use, is a mental health professional that is able to talk to them in that moment of crisis to determine the level of care they need. Is that right?
Yep.
Okay.
That would be licensed psychologists, counselors. LICSWs are clinical social workers who are qualified to do those types of assessments.
Okay, good. Well, that sounds really good. That's great. So another thing I wanted to ask you, you mentioned adult. So as far as inpatient care and adult care, or for adults, Can you help us understand exactly what point is one adolescent versus adult, and what happens to the adolescents if we can't admit them?
Sure. We take, for safety's sake really, David, we take ages 18 and up.
Okay, 18 then, is it?
Yes.
Okay.
And there's no upper limit of age either. It all depends on the person's needs.
Okay.
At this time, we don't have an adolescent inpatient unit. We do have one at the university down in the cities. So an adolescent that goes to our ED will also receive an assessment, and they'll help with placement. At this point, we don't have the certified, our psychiatrists aren't certified in child and adolescent, nor are our nurse practitioners. I won't rule that out in the future, but for right now, we don't have the ability to give that inpatient piece.
Yeah, very specialized care for those
specialized.
individuals. Sure, sure, that makes sense.
But we do recognize it's a huge need in the area.
Right.
And we have added some support in our outpatient for child and adolescent.
Okay, good. Partial hospitalization program. Heard a little bit about that. What exactly does that mean, Paula? What is that? What kind of program is that?
Well, partial hospitalization is a Monday through Friday program where patients come to the hospital and they receive 5 to 6 hours of group therapy and individual therapy. They have the ability to see a psychiatrist, a nurse practitioner for med management. They can get individual counseling. They see an occupational therapist. And then they have 4 to 5 different group therapies by licensed professionals. The program is usually about 21 days, but if an individual needs more time, we would just talk to the insurances and they could go for longer. We feel this is going to be a great new addition because these patients are either they're being discharged from the hospital and they need that support system, or they're being taken care of in outpatient and they're getting sicker, but they're not really meeting the criteria for inpatient. So it's a way for us to help them and stabilize them so maybe they don't have to stay overnight in the hospital. They can go home, go through our program, and then go back to their outpatient provider.
Oh, what a great program.
It will be.
So, again, it sounds like for individuals who don't really need the inpatient care, but maybe need something a little bit more than just simple outpatient. Okay.
Yeah.
Now, is that program started already, or?
It has not.
Okay.
We are in the middle of remodeling and preparing for that.
Okay.
We anticipate that the first thing to be open will be our new inpatient unit on 5 North.
Okay.
And shortly after that, our partial hospitalization. We're setting a target date of January 1st to be realistic. But if things go really well and we're able to launch the inpatient unit first, we may open earlier than that. So
there's a lot going on.
there is. There is.
So once the program is up and running, how would someone get into that program? Or if they felt like, gee, I'm really interested in that, or I think that would be beneficial to me, how do they do that?
They do that through, they have to be referred through a psychiatrist.
Okay.
Okay, and we do have a psychiatrist. Dr. Misty Eliason is going to be the psychiatrist in charge of our partial hospitalization. So they could go to their primary physician and say, I've heard about this service, and they would then talk to Dr. Eliason and be referred.
And where is she located?
She's in our Masaba Clinic in Hibbing.
In Hibbing, okay.
And we can receive referrals from psychiatrists in other places as well for patients that live in our area.
Okay. And Dr. Eliason, is she a full-time provider?
4 days a week.
Okay.
Yeah, almost full-time.
Which it seems like in our today's world is pretty close to, a lot of providers work at 4 days a week, so that's understandable, so good, okay. Outpatient care, we touched on that just briefly, and I know you have a lot of outpatient care or services available too. So tell us about that.
Right, we have in the last year just been adding days and therapists, and every person that we add fills up very quickly, which tells us we need to add more. So let's talk about psychiatry and nurse practitioners, if that's okay.
Sure.
Dr. Eliason is our psychiatrist. She and the nurse practitioners work hand in hand with our family docs. Our family doctors are fully capable of managing mild to moderate depression. So they will refer to Dr. Misty or to the nurse practitioners. And when patients go to them, they may have a few more medical needs, not medical, but a few more medicine needs.
Okay.
So they work together as a team, really.
Okay.
And the other outpatient services that we have 3 therapists currently that work in our Hibbing clinic. One of them, Maria Cesari, is an LICSW, which means she can give therapy as a social worker. She is able to take patients for individual or couples counseling.
Okay.
We have Reverend Steve Breitbarth, who also works as a volunteer chaplain at our hospital, and he's been in the area for many years,
Yes.
so a very trusted professional in our community.
Right.
He is an LMFT, which is a therapist or a counselor, and he provides marriage and family counseling.
Okay.
We are also very excited to say that we have Jennifer Kendall, who is full-time. Jennifer specializes in early child and adolescent therapy.
Oh, good.
So Jennifer will take very young children even, and she'll do family therapy with the whole family, and she'll take adolescents, which, like we talked about earlier, is a big gap in our area. That, where do people with childhood or adolescent mental illness go? Well, now we have one option for them within our own little system.
Right, that's excellent.
So
good. So if someone wanted to have outpatient counseling or couples counseling, can they just call and make an appointment, or
Yes.
does that require a referral? Or
it does not require a referral.
Okay.
I have the number here
Sure.
because I don't have it memorized yet.
Okay, you can share that with us.
And it is 866-806-7139.
Okay, great. I know we can get that up on the screen, hopefully for
Yes.
people too. So good, good.
And also, I just wanted to say, usually our primary docs, if a person hasn't had psych services before, our primary docs will make the referral. But if people have had psych services before, they can call this number as well
Okay.
to see a nurse practitioner or a psychiatrist, Dr. Eliason.
Okay.
So.
All right. Very
Yeah.
good. So how would someone know? Is there certain things that we should watch for in ourselves or our friends or family that are somewhat indications that maybe they need some counseling or benefit?
Absolutely.
Okay.
And I'm going to read these.
All right.
The NAMI organization I told you about,
right.
they have good resources like this. So one thing we can do is to recognize some common signs in our loved ones, maybe even in ourselves. And I'm going to read the list to give examples.
Okay.
Excessive worrying or fear, feeling excessively sad or low, confused thinking, problems concentrating and learning, extreme mood changes. That includes uncontrollable highs or feelings of euphoria, prolonged or strong feelings of irritability or anger, avoiding friends or social activities, difficulties understanding or relating to other people, changes in sleeping habits or feeling tired and low energy, changes in eating habits such as increased hunger or lack of appetite, changes in sex drive, difficulty perceiving reality. Would include delusions or hallucinations. A person can experience and sense things that don't exist. People may not know this, you can have auditory hallucinations as well as visual, because we have all kind of seen on TV and in movies, you know, they depict people with mental illness that is having visual hallucinations, but a lot of patients have auditory. They hear but not necessarily see the hallucinations.
Okay.
So a couple more: inability to perceive changes in one's own feelings, behavior, or personality. They may abuse substances like alcohol or drugs. Multiple physical ailments without obvious causes, like headaches a lot, stomach aches a lot, vague and ongoing aches and pains. Maybe they go to the doctor, maybe they don't, but if that's increasing, that could be a sign. Thinking or talking about suicide. I mean, when people talk about suicide, that's really apparent. If people are thinking about it, they should talk to somebody.
Okay.
They should really talk to somebody.
Yeah.
And then just finally, a change in a person's ability to carry out their daily activities, like losing interest, not wanting to do things, an excessive fear of weight gain, or concern of appearance are also signs mostly for adolescents.
Okay.
So those
Good.
are...
That sounds like a great advice, and I'm sure that that's something that hopefully will be beneficial for others to hear and know about and maybe watch for as well. Paul, I'm just curious. I know you've worked in healthcare for a long time. My perceptions, I think, and I'm just curious kind of what your reaction is, that the public's attitude regarding mental health, mental wellness has changed over time. It seems like, certainly from my perspective, it has to some extent. I'm just curious if you feel like it's changed. Is there greater acceptance? Is there less stigma involved with mental health?
We're getting there, but we have a long way to go.
Okay.
Part of national mental health awareness and a lot of the public campaigns that you'll see have to do with making it okay to talk about it. You'll see commercials nowadays where celebrities with significant mental illness open up and talk about what it's like. I've seen a lot about make it okay. Part of what we can do as friends and family is to be accepting, to listen, to learn about it. Did I mention our mental health first aid classes?
No, you didn't.
Okay.
Please do.
We have 2 certified instructors that are certified to do mental health first aid classes, and we are going to do a year of free classes for St. Louis County and Itasca County. There are 2 different classes. One is for adults and one is for youth. And so we're going to be advertising when the dates are available, and really anybody can attend. I would encourage everybody to attend. We're happy to go on the road. We will go to schools, churches, law enforcement, colleges.
And just real briefly, tell us, what does it teach you? I mean, what's the first aid?
It's just very common things that, just like what we're talking about today, but in a little more depth. How to not only recognize the signs, but how to talk to a person so that they don't feel ashamed.
Okay.
And how to talk to them, to encourage them to get help, and to let them know you care. You may not understand what they're going through, but that having a mental illness shouldn't be any different than having a physical illness. And that's the exciting thing that's happening today in healthcare, is the concentration on the parity between the two. Nobody thinks twice about saying they have diabetes. Right? But people may think twice about saying they have bipolar. They're both chemical ailments that happen in our bodies and in our brains.
Great example. Thank you. Yeah. Good. Well, the first aid classes sound really interesting, and you said they're going to be free.
Yes.
Okay. And offered when?
Well, we
next
have
year,
to.
Or?
I would give us. It's going to be in the next 2 months.
Okay. So probably be promoted or advertised. And
we'll have it in the. We're going to start in Hibbing,
okay.
And in the area, but we'll be putting it in the public announcement pages of papers in the shopper.
Okay.
It'll be on our website as well.
Good.
And as will the youth ones once we're ready to go. We'll be providing them at least once a quarter. We think in the first year it'll be probably once to twice a month, so that we can get the word out. And as people know more and they feel more comfortable about how to deal and talk with people, it'll just make things better.
Good.
So.
Good. Well, it sounds like a great community service, and so we can watch for that. Unfortunately, I think we're about out of time.
Oh,
Paula.
you're kidding. This went by really fast.
Yeah, I did. Thank you so much for your time.
Thank you,
I know
David.
you're really busy, and just grateful for your time. And it's really exciting to hear about all of the development in the behavioral health arena that's going to occur right here at Fairview Range here in Hibbing, and to offer greater services available to those that might need it. So that's great. We're glad for that. So thank you again.
Thank you.
And thank you to everyone for watching today. Watch next month for another Fairview Range Focus. And again, my thanks to Paula Pennington, Director of Behavioral Health. So thank you again for watching.
Hibbing Public Access Television would like to thank U.S. Bank for providing us with studio space.